a relatively new development when it comes to patient care, a hospitalist program. Urban hospitals have been implementing this for a little less than half a decade now, but they're relatively new to rural hospitals. And we're going to learn about the newly implemented hospitalist program here at Upland Hills Health. And I've got a great team of people that we're going to be speaking with today, including CEO Lisa Schnedler. She's going to be talking a little bit about the addition that is coming here to Upland Hills Health, as well as the hospitalist program. Plus, Danielle Sculla, Director of Acute Care here at Upland Hills, and the two new hospitalists, Dr. Sarah Rabarzik and Dr. Ingrid Berg. From Upland Hills Health here in Dodgeville, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Upland Hills Health in beautiful Dodgeville, and I am so excited about our first guest today. I'm joined now by Lisa, who is the President and CEO of Upland Hills Health. How are you, Lisa?
Doing great.
We finally got you on the show.
I know.
So excited about that.
Oh, it's good to be here.
Give, since this is your first time, give the audience or the viewers a brief description of your job and just introduce yourself.
I'm the president of Upland Hills Health, and I've been here for 5 years, and just a phenomenal place to work. Great team, great community, wonderful patients, and as you'll see today, great physicians.
Awesome, awesome. That was really well succinct. You must have practiced that a little bit. So there's a lot going on here at Upland Hills Health, including a building project.
There is.
So tell us a little bit about that.
Well, it's a $32 million building project, and we've been trying to get this on the ground for 2 years now, and so we're so excited that we're finally ready to kick this off. We're in the enabling phase right now, and that means we're moving people around, and we're trying to make sure that everything moves smoothly, so when we get ready for construction, it'll be very smooth sailing from there.
Very good, very good. 2 years and it's finally happening.
It's finally happening.
Does that seem a little bit surreal at times?
It does, it does.
Just realize, wow, this is actually going to happen.
I know.
You know, they say that everything is built 3 times, once in your mind, once on paper, and once physically. So now we're going to get to the physical part of it.
That's a great way of putting it.
That's pretty cool. So today we want to learn a little bit about the hospitalist program that you're implementing. But before we do that, can you tell, you told us a little bit about the building project. You're going to have surgical suites, birthing unit. Can you kind of expand on that a little bit?
Sure. So we like to break this project into several components. We say, first of all, we're trying to really serve our patients well. And the first way we do that is we try to move our services into the central part of the hospital. So right now, if you were to walk from our gift shop all the way to our bird aviary, I think you've seen that before.
Yes.
So if you did that 5 times, you would do a mile.
Yes.
And so it's great for walkers, right? But not so good for people who are infirmed. And so we want to really be able to bring those services to the central part of the hospital, and we're doing that by adding a floor on top of the hospital.
Oh wow, building up.
Building up.
Wow.
So all new med-surg, all new patient rooms, med-surg, ICU, and then OB. So it'll be very, very nice.
Very cool.
Yeah, very cool.
Yeah, so not as much walking maybe.
Exactly.
If the need is not there. So obviously you're upgrading the facility and you're bringing in new programs.
Yes.
We're talking about the hospitalist program here. What exactly is a hospitalist?
So we, about 2 years ago, our clinic physicians, our primary care doctors came to us and they said, we just feel kind of torn apart at this point because we are running back and forth from our clinics to the hospital. And both areas are becoming more and more complex in terms of medical knowledge. So physicians have to learn many, many more drugs. In fact, a friend of mine who's a physician once told me, when I went into medical school, this was back in like the 50s, so he's an older doctor, there were 3 antibiotics.
Yeah.
You can only imagine how many there are now and how that's changing.
Yeah.
And so the clinic world has really changed and the hospital world has changed. They both have become more and more complex. And so they asked us if we would look at specialists who specialize in hospital medicine so they could focus on their clinic practice. And that's what the hospitalists do. You come in, they treat you as an inpatient, they work in conjunction with your family practice physician or your internist, and then they discharge you back after your stay.
Interesting. Wow. Yes. Is this something that a lot of hospitals are implementing now, or is this a pretty new thing?
You know, I'd say for those smaller hospitals like Upland Hills Health, It's pretty new, but
Okay.
for University of Wisconsin, for SSM, St. Mary's,
Sure.
all of the larger facilities, they've probably had them for 5 years.
Okay, okay. So not that old.
No.
So 5 years is not a long time, especially in the
Correct.
world of medicine. So, so why now? Why are we bringing on these hospitalists now?
Well, you know, we really slowed down the pace because we could have just brought an outside firm in here and just, you know, started it right
Sure.
away. But our doctors really care about their patients, which is an awesome thing about this facility. I mean, they deeply care. And they said, we want to be on the forefront of this. We want to help interview the physicians. We want them to be employed, and we want to know them. So they literally picked up the phones and started calling to try to find out who would be the best physicians for
Wow.
this program. And so you're going to meet some of those physicians today. They are wonderful. So they were selected by our physicians to come in and care for their patients.
Oh, you just gave a great pitch for the rest of the show here. So we'll see you next month then, right?
That's right, that's right. That's
Lisa,
right.
President and CEO of Upland Hills, thank you so much for being with
Oh,
us today
thank
and
you.
for having us come here. We always enjoy coming to Upland Hills.
Yeah, enjoy having you.
And don't go away, there's more Wisconsin Doctors coming up right after the break, so stick around. Welcome back to Wisconsin Doctors. We've been here at Upland Hills Health. We just got done speaking with Lisa, the CEO, a little bit about our hospitalist program. We're going to continue talking about that now with the Director of Acute Care Services. This is Danielle Sculla. How are you?
I'm good. How are you?
Good, good. Good to have you with us today. So before we get into the hospitalist program, can you give us just a brief history of you, thumbnail biography, born, raised, went to school?
Sure. Yep. Wisconsin. Haven't left.
There you go.
I mean, yeah. So I went to school, got my associate, and then my bachelor's, and then was from Argyle and now in Highland. So all communities that comes to this hospital. So I haven't traveled far, and I've been here for 3.5 years. That's about me, really.
Okay, so you're a native of this area then?
I am Southwest Wisconsin.
Southwestern
I haven't been.
Wisconsin. There you go. There you go. Got to represent, right? So let's talk a little bit about the hospitalist program, because this is obviously something that it's fairly new to hospitals, as we learned from Lisa. You know, some of the more urban hospitals maybe have only implemented this as little as 5 years ago. But this is definitely a new thing for Upland Hills. So talk to us about why this is such a good thing and how it's going to benefit patients.
You know, really, Lisa did a great job at explaining it. It's so nice to see that the primary physicians are not being pulled back and forth. I don't blame patients for wanting their doctor, and I am the same way. And especially in this area, in our hospital, the patients choose their doctors because of who the doctor is, and they care so much about each patient. And so with Lisa saying that our doctors are the community's doctors, the family practice doctors are the ones that chose these hospitalists, and so they trust these hospitalists, and that says volumes. But having somebody, a physician here in the hospital, 24 hours a day, or maybe not in, but all day,
right,
is, the nurses can ask questions, the patients can ask questions, the families can ask questions, and we get an immediate answer. And before, it was calling the clinic and asking the doctor when they're not with a patient to call us with these orders or answer this question. And so there was a time that we would be waiting, and now we don't have that. So
you have less lag time, and that allows for the care to happen sooner and more efficiently. That's awesome. So, are patients caught off guard? We talked a little bit about how patients choose their doctor based on who they are. Are patients ever caught off guard when a new doctor checks on them, or not so much?
Yes, I'd say yes and no. They may be caught off guard, and their questions are things like, does my doctor know I'm here? Does my doctor know what your treatment plan for me? And do you know what my doctor has already done for me? But the comfort level with the hospitalists and having a different doctor is not really a question or a concern. We've had in the past, there was always there was times that a doctor from each clinic rounded for patients, so it wasn't
Okay.
always their doctor anyway,
Sure.
but one that was working closely
Whoever
with.
was on call or
Right.
whatever that day. So in all those questions that the patients are asking, would the answer be yes to all of those? Does my doctor know that I'm here? Yes.
It
Do
would.
they know that what he's done for me so far? Yes.
Yep.
So those are all good things. So the communication is definitely happening there. So how would you say this is going to affect processes and procedures in patient care overall?
You know, really, the one thing I love about Upland Hills Health is that it is small enough to be individualized and make every patient feel special, but big enough with enough resources for us to give that quality care, and that's not changing, and this actually adds to it. So it's not going to, if anything, it'll improve it. But I don't know that it's going to be a change that patients really see. It'll be more the, like those processes that making them more efficient.
Absolutely. Yeah, that's what we need. That's what's important in healthcare is getting that efficiency of care. So, well, Danielle Sculla, thank you so much for joining us today. I appreciate all the information.
Yeah.
Danielle Sculla is the Director of Acute Care Services here at Upland Hills Health. Don't go away. When we come back, we're going to meet a couple of the new hospitalists here at Upland Hills Health. Stay right here. Welcome back to Wisconsin Doctors. We've been here at Upland Hills Health, and we're learning today a little bit about the hospitalist program that they're implementing here. I'm so excited because we now finally get to talk with one of the new hospitalists. This is Dr. Sarah Rabarchik. How are you?
I'm good.
Good to have you with us. And I want to make note that to the viewers that the day we tape this is day 3 for you here at the hospital, so we'll go easy on you.
Thank
I
you.
promise. So give us a little bit of a background of where you're born, raised, went to school, that sort of thing.
I was born and raised in Prairie du Chien, so pretty close to here. I still live there. I trained in Madison. I went to college and was in engineering, and then I went to medical school and actually did residency in Madison. I was thinking about going further away because people in Wisconsin get teased about never leaving, but
It's true, I'm 4th generation.
I know, but I decided not to because my parents were ill. There were reasons that I stayed, but it was a great education, and then I practiced in Madison for a while before relocating back to my hometown and practicing medicine there for a period of time. And this position came available here in Dodgeville, and I really like hospital medicine and thought this would be a great place to work.
Excellent, and I think it is a great place to work. It's always a great place to come and film a TV show. So now you get to kind of specialize in hospital medicine here at this location. At your previous career, your previous job, I should say, you were kind of split between hospital medicine and you also did primary care.
Correct.
So what do you see as the benefits of being in a situation like this where you get to focus?
I think the patient care improves a great deal. I think the patient satisfaction improves, primarily because you're there all the time. You know everything that's going on, and you're not torn between a lot of work in another place and all the work you have to do.
Yeah, absolutely. And I can tell you have a lot of passion for your patients, and that's something that is really common here at Upland Hills Health for the doctors to really, truly care about their patients. So talk to us a little bit, I'm going to put you a little bit on the spot here, but talk to us a little bit about some of the more memorable, rewarding experience you've had working in hospital medicine.
You know, initially it was a challenge kind of moving back into that setting.
Sure.
My training was internal medicine. So when I
Okay.
trained in Madison, all of my training was inpatient medicine. I did very little clinic medicine, and so getting back into it was really rewarding. I think the nicest thing is having the people come back, you know,
Sure.
because when people start to have health problems, they tend to come back in the hospital relatively frequently.
Right.
And it's just so nice to walk into a room and, you know, the patient looks at you and you get this big smile
Yeah.
and they're immediately comfortable
Yeah.
with the person who is taking care of them. When you first transition to a hospitalist program, I think that's a little challenging because you get the where's my primary care provider.
Sure.
But as people move forward in this, I think they see the benefits, the patients see the benefits as well.
Is it more intense being in hospital medicine than just kind of doing primary care providing?
It's a different intensity because
Okay.
the patients are sicker,
Sure.
but that volume and that push is a lot less. You have control over what you do
Right.
as opposed to not having as much control. You
Right.
are able to prioritize
Sure.
what needs to be done, when, and how to best accommodate the patients. And I think that, especially as you've been in practice longer, which I have, that becomes it makes you much happier
Yeah.
as a provider.
Absolutely, absolutely. We just have about a minute left here, but I want to make sure that the viewers who are watching right now get to know you not just as a doctor or a hospitalist, but as a person too. So what are your interests outside of work? What do you like to do to recreate?
Spend time with my family. I have 2 boys in middle school. Dog, cat. Yeah, I like animals a lot.
So wait, now the 2 boys are not the dog and the cat?
No,
That's-
no,
okay, those
no,
are separate
no.
things. Okay,
Yes.
just wanted to clarify that. So.
Yeah, it's a house full. I like to do just about anything.
Okay.
Activities, sports. As I get older, some of that gets challenging. I did take up downhill skiing for the
Okay.
first time when I turned 50 last year.
Hey, what a time to start, right?
I know, and I didn't fall. Well, I did fall, but it was fun. And yeah, so pretty much anything. Like I said,
Yeah.
I'm pretty easygoing.
Easy going. Well, you did a great job here today. Dr. Sarah Rabarczyk, thank you so much for joining us
Thank
today.
you.
Don't go away. There's more Wisconsin Doctors coming up right here at Upland Hills Health after the break. Welcome back to Wisconsin Doctors. We're here at Upland Hills Health, and we've been discussing their newly instituted, I should say, hospitalist program. So we're really excited to be talking with another one of our hospitalists here. This is Dr. Ingrid Berg. How are you?
I'm fine, thanks.
Yeah, first time here on Wisconsin Doctors. It's always good to have somebody new and see new faces, so thanks for being with us today. So why don't you give us a little bit of a background, just kind of a thumbnail biography, born, raised, went to school.
I grew up in Hartford, a farm town on the other side of the state. Went to UW-Madison for undergrad, and then met a guy from the Chicagoland area, and we lived in the Chicago area for many years. Was a stay-at-home mom, and then I went to medical school. I went to the Chicago College of Osteopathic Medicine in suburban Chicago. Also did my training nearby at Hinsdale Hospital, a community hospital nearby. But after that, I felt this kind of pull to come back to my roots. And so my family and I, we moved back to rural Wisconsin, found a job here with great partners, great patients. And I enjoy doing the full gamut of activities, inpatient, outpatient, delivering babies and so on, nursing home. But I found that my greatest love was doing the hospital work. And so I decided to transition into hospitalist medicine. And I did that actually for a while at another rural hospital, but then an opening came up here, or actually a new program started here at Upland Hills. And so I returned to be kind of a charter member of the hospitalist program here at Upland Hills.
Awesome, awesome. That's a great story. Now, I have to imagine that there are just maybe a few differences between practicing in urban or suburban Illinois than rural Wisconsin. So what are some of those differences, and what are some of those differences?
Well, certainly in the urban area, there's more of a specialty-driven focus, I think. In fact, sometimes during my training, I would have colleagues say, like, why do you have to learn all of this? You're never going to use all of this information in family medicine. And I think that really put a fire in my belly to go somewhere where, in fact, you can do more than one kind of thing. And in fact, patients expect you to be kind of a bit of a jack of all trades.
Yes.
Of course, that being said, now I'm more focusing on inpatient medicine, but I can see babies, kids, and adults in the hospital. I may have a role in occasionally helping out, with a C-section. And so I still feel that primary care focus is so valuable, especially in a rural setting.
What would you say overall in your career thus far has been some just rewarding experiences you've had either at your previous career or here at Upland Hills?
For me, it's about end of life. I really enjoy having that extra time at bedside.
Sure.
And that's what inpatient medicine, that focus really allows for, helping folks, shepherding them through the the most vulnerable moments of their life,
Right.
and being readily available for conversations all day is something that a hospitalist can do. It's just easier for those who are kind of shuffling back and forth between clinic and the hospital. Family members can't always come at the same time,
Right.
and so I think being that resource for folks is what's really, really valuable for me.
Absolutely, and that you talk about end-of-life care. I mean, we all want to try to get the last few moments and maximize those moments of a loved one's life. So, I mean, you kind of provide that opportunity for family members, which is awesome. Very cool. So, talk to us a little bit about you in general. What do you like to do outside of the hospital?
When I moved here, we, as a family, embraced learning to ride horses.
Wow,
and so we
okay.
take family horseback riding lessons, my husband and my daughter and I. They each have a horse, I do not, but I am steadily learning more about them. So we're really enjoying that, and that's something that would have been difficult to do, in an urban area.
Right, absolutely.
So.
And are you riding in this area? I mean, is this, you're staying within the area? And how many kids do you have?
I have one.
Okay.
Yeah, middle schooler.
One middle schooler.
Yeah,
okay.
8th grade, about to
Yeah.
graduate.
It's still a handful, I would guess.
Yeah,
Right?
yeah.
I bet she's great, though.
I'm a little biased, but yeah.
Of course, of course. Well, Dr. Ingrid Berg, thank you so much for being here with us today and explaining a little bit more about the hospitalist program and what you guys do here at Upland Hills Health to help patients. We really appreciate it, and we look forward to having you again.
Thank you.
Yeah. This has been our show here at Upland Hills Health. They have a new hospitalist program. If you have any questions about what that means, give them a call. Go to their website. That's all for us here on Wisconsin Doctors. From all of us, we invite you to live longer, live better. We'll see you next time.